you know what, it's the passion for it, really, you know, and I don't think it'd work otherwise. You've just got to really have a passion for it and to love what you're doing.
I would say definitely having the right personality, the person to do the job. It's got to work, otherwise it will fail straight away. It's not down to the qualifications, it's definitely down to the personality and their experience, and somebody who knows the local area. Very important, because they need to link in with all the other clubs and services that are available and build a relationship, and then once they're comfortable with the other services, know of them, they can promote them to the patient.
Having the right partnerships within a community. We have to define what that community is. It can't be too small, it can't be too large, it has to be the right size.
I love that this is based within the voluntary sector. There's a lot more of an holistic approach to a patient, which I think is amazing. But the fact that it's based within the voluntary sector, we don't have a lot of red tape and hoops to jump through. We've got our boundaries, we've got our procedures and processes, but it's just a lot more informal, and we're able to be flexible and creative.
There has to be a way of accessing all the assets within the community that people are able to, so there has to be a coordinator within that.
We like to be at the cutting edge of things. I think we're quite innovative. We've got people within practices, GP practices, within CVS and elsewhere, who are innovative, who are willing to run with a new idea and are quick to latch onto it and see the benefit. And I think bring all those things together, the need, the people who are willing to go for it, and you're going to have a success with a bit of luck if you can find the funding.
The people who have the greatest need and who can refer the patients need to also know. So the GPs and our practices need to know.
You've got to have a very secure process in place that's tried and tested, so we can audit it.
So empowering the patient to make the right choices for themselves, they're more likely to improve their health and their well-being because they had that opportunity.
We had a vision about how this project was going to work, how many sessions we would offer, and it just hasn't worked that way, because every single person is different, they're unique, they're individual, their needs and their wants are very different to the next person you're going to see. So I think being able to focus on that individual and not stick them in a box is very, very important.
Access to the computer medical system, so clinicians can see that the patients access the service and can see the patient's journey, and if they fall off the radar for any reason, come back again. The clinicians can ask the patient, how did that help you? Is there anything else that we can do for you? Would you like to do it again?
So if you were in a general practice, the three things that are really important for us is that the partners within the practice, the leaders within the practice and the managers need to believe in social prescribing. That is really key. Then once they believe and are promoted, then our whole practice staff, including our receptionists, need to know. That is important because in our surgery, 80% of all the social prescription referrals are done by our practice staff, not by GPs. So the practice staff knowing their patient and the services are able to refer. The third and most important one is our patient participation group. Is key in this because they've always known in our surgery about the patient about social prescribing. They've promoted it. They've had Tracy come and talk to them. So they are great champions for promoting it. So the usage of the social prescribing opportunities are hugely increased and hugely valuable when all the three parts of the system within an organisation like a general practice know.
And then the other thing is sustainability. We need funding. It's an amazing project. We've done a lot of really good work. We've made a lot of really good links. And it'd be a shame if that came to an end because of the financial constraints that we have. And then only in 5 or 6 years' time for somebody to go, oh, I've got this fantastic idea, let's do this, when you already had that. So sustainability is vital.